Hi, good afternoon.
Hi, Dr. Chichita.
Hi.
All right, great.
Yeah, it is a section 2, room 2. Yes.
Okay.
Welcome. Here, our first presenter is here. Still need some presenters. Okay. Okay, good morning, everyone. Welcome to the poster presentation finalist section 2 of the 34th MSPB scientific meeting. Today we have poster presentations, altogether 12 presentations. I think some of our presenters haven't get into the room yet. Please identify yourself. Here are the finalists too. So please let us know or raise hand function if you cannot enter as a presenter. That is for the panelists. Okay, we have first presenter, Siti Masre. Yeah, she is here. Okay, so I think we can start without further ado. First, I would like to greet all of you and welcome to the poster presentation finalist section 2. Today we have 12 presentations in total. And we have, I am Chichita from Jeffrey Cha School of Medicine, Monash University. And we have our 2 judges today, Dr. Farah Shafira Ibrahim from the Department of Basic Science Physiology, Faculty of Health Science, University Technology, MARA, and myself will be a judge together. So we will have a presentation, pre-recorded presentation will be played first. Then we'll have a live Q&A section by the judges. Okay, so without further ado, I would like to call the first presenter, Siti Fathiah Masre. from University Kapasan, Malaysia. The title is Antioxidant Activity of the Pterostilbene in Lung Squamous Cell Carcinoma in Vivo. Okay.
Assalamualaikum and hello everyone. Today I will present my poster entitled Antioxidant Activity of Pterostilbene in Lung Squamous Cell Carcinoma in Vivo. So what is this study about? In this study, we would like to determine the effect of pterostilbene on antioxidant glutathione and superoxide dismutase, and we would like to determine the effect of pterostilbene on lipid peroxidation and protein oxidation in lung SCC via in vivo model. So, basically, for your information, although there have been a lot of studies being done using pterostilbene in lung cancer, particularly non-small cell lung cancer, data on the antioxidant activity of pterostilbene in lung SCC subtype by in vivo model remain limited. Therefore, in this study, we will use the in vivo model, which is the mouse model, and we divided it into 4 groups, 2 treatment groups and 2 control groups. So for the treatment groups, we have 2 doses of pterostilbene, high and low doses. And after 24 weeks, here are the results. You can see a significant increment of GSH and SOD levels. And we can see that significantly decrement of lipid peroxidation and protein oxidation upon pterostilbene treatment. So as a conclusion, pterostilbene is capable of increasing the SOD and GSH antioxidant levels. At the same time, pterostilbene treatment has reduced the oxidative stress levels in lung SCC by decrement of lipid peroxidation and protein oxidation. Overall, pterostilbene exhibits strong radical scavenging and antioxidant activities, indicating its potential as a chemoprevention agent in lung SCC. That's all from me. Thank you.
Thank you, Siti. Now I would like to call Dr. Farah Shafira for the questions. So Siti, you can change to the presenters mode, okay? Panel mode. Okay.
Siti, are you there?
Yes,
Sheila.
she is there.
Nice presentation. Would like to share with us why do you think that high dosage, which is a PS50, increase the SOD and also the GSH? What do you think the principles, the mechanism behind it?
Okay. First of all, thank you very much for this question. Okay, actually, this study is a sub-continuation of the bigger project that we have done before. So we have seen previously that pterostilbene actually works as a chemoprevention agent by reversing the lung squamous cell carcinoma formation. So we want to see what is one of its actions. So we look into the antioxidant mechanism. So we do the small work on antioxidant activity. We look on the SOD and GSH activity. So from the 2 concentration, PS50, which is the high doses, showed a significant increment of the superoxide dismutase. As we know, superoxide dismutase is the enzymatic antioxidant, right? So the enzymatic antioxidants plays a first defense mechanism. The SOD plays first defense mechanism to combat the reactive oxygen species, all right, that occurred developing while the lung cancer is progressing. So this study shows a promising outcome where there is a significant increment of the antioxidant activity by giving the pterostilbene. That's all from me. Thank you.
Thank you.
Thank you.
All right.
Thank you, Siti and Dr. Shafira. Okay, very nice presentation. We will move on to the second presenter.
Assalamualaikum and hello, my name is Ashraf.
Okay. Our second presenter is Ms. Alisha from the UKM. The title is microRNA profiling of human umbilical vein endothelial cells exposed to the hypertensive disorders of pregnancy using the RNA sequencing. The floor is yours.
Assalamualaikum and hello, my name is ASLAH from University of Asia. I'm presenting this poster with part of my co-authors and our presentation entitled MicroRNA Profiling of Human Umbilical Vein Endothelial Cells (UVAD) Exposed to Hypertensive Disorder of Pregnancy using RNA Sequencing Analysis. Hypertensive disorder pregnancy is a high blood pressure in pregnant women, which affect 3 to 8% of pregnancy worldwide. Previous researchers has found units of hypertensive disorder pregnancy has changes in endothelial function and also high risk in getting hypertension in adulthood. MicroRNA is a small non-coding RNA which regulates expression at post-transcriptional level. This regulation of microRNA in UVAD has caused hypertensive disorder pregnancy. However, studies in microRNA profiling of hypertensive disorder pregnancy of endothelial offspring limited. In this study, we want to compare normotensive and hypertensive microRNA profiling by using RNA sequencing analysis. 8 of normotensive pregnant women and another 8 of hypertensive pregnant women were involved in this study. After we collect 16 umbilical cords, we did isolation and culture and extract the total RNA from the cell and perform the RNA sequencing analysis. We found there are 2 highest upregulated microRNA in the hypertensive disorder pregnancy, which are microRNA 6753B and microRNA 196A5B, and their target gene is SP3, GAL5, and GALNT10. Previous researchers reported these target genes were involved in atherosclerosis and angiogenesis. Thus, further studies need to validate this microRNA function and also their target gene in the hypertensive disorder pregnancy. Thank you.
Thank you very much, ASLAH. A very good presentation. Okay, I have one question to you. You have done very well in your microRNA profiling, and what will be your next step or further step? How will you progress from here?
For the next step, I would like to validate the target gene by using the qPCR, and then after the validation, we want to see the link in between the microRNA and also the target gene by using the luciferase assay.
Okay, thank you. Thank you very much. NABILAH? Okay, we will move on to the third presentation. Said Moshawih from the University of Brunei Darussalam. The title of the research is Anti-Cancer Potential of Alloimodin and its Derivatives in Vivo and In Silico Perspectives.
Hi everybody, I am Moshawih from University of Brunei Darussalam. My presentation today is about in vitro and in silico activities of alloimodin derivatives on various cancer multiplicities. Alloimodin is a naturally occurring compound, phenolic compound that is extracted from many plants such as aloe vera leaves. Alloimodin and its derivatives show their in vitro anti-cancer activities on gastric, breast, liver, and colon cancer cell lines by cell cycle arrest and apoptosis induction. In this review, we will try to summarize alloimodin derivative activities on cancer and structure activity relationship. Firstly, the presence of oxygen and hydroxyl group on carbon number 3 of the aliphatic ester increases the solubility and cell permeability. Secondly, the anti-angiogenic activity has significantly increased due to the acidic substitution on carbon number 3 or carbon number 6. Thirdly, the pyrazole-linked allo group on carbon number 3 induced the early and late apoptosis and cell cycle arrest. Differently, an in silico study predicted that that trihydroxy group on the 1-oxytoluene has superior activity on BAX protein for breast cancer cells. In conclusion, most of the imodine derivatives has higher anti-cancer activities than the original compounds, and I would like to indicate that triazole ring and aniline on carbon number 3 is expected to show strong affinity and stability as our unpublished data is indicating. And thank you very much.
Thank you so much, Said. Now, I would like to call Dr. SYAHIRA to ask a few questions.
Yes, welcome. Sorry, doctor, I couldn't hear.
Dr. SYAHIRA, you need to unmute. Thank you.
Yes, all right. Thank you, Dr. Chichita. Well done. So very clear presentation. I just like to clarify with you, Dr. Said, whether this is a systematic review or a review.
It is a systematic review.
Okay, because it is not stated in the poster. Thank you.
Yeah, thank you so much, doctor.
Thank you, Dr. SYAHIRA and Dr. Said, for the presentation. Okay, we will move forward to the next presenter. Next presenter is from the Pakistan, Syed Zayed Postgraduate Medical Complex from Lahore, Pakistan. Presentation title is Knowledge, Attitude, and Practice of the Clinicians about Antimicrobial Stewardship and Resistance among the Hospitals of Pakistan, a multi-center study. Presented by the Ashraf Sohaib. Okay, we're ready. Then
we asked them. Hello everyone, my name is Dr. Sohaib and I'm a cardiologist working at Masre Hospital. Today's topic of discussion is knowledge, attitude and practice of clinicians about antimicrobial stewardship and antimicrobial resistance. As we all know that post-COVID era is going to the results, we asked them about the empirical treatment of upper respiratory infection, lower respiratory infection, all other infections. The crux of the story was that none of the doctors, all of the doctors have a different opinion towards empirical treatment, and none of has that proper guidelines that they are following towards prescribing drugs. As far as the correct antimicrobial spectrum was concerned, we asked them about the correct antimicrobial spectrum of various drugs, antimicrobials. About the ampicillin, 1.4% of the doctors gave the correct antimicrobial spectrum of ampicillin. About erythromycin, one doctor gave us the correct antimicrobial spectrum of erythromycin, and none of the doctors gave us the correct antimicrobial spectrum of levofloxacin. However, about the antimicrobial resistance, they do feel that it's a problem worldwide. They do feel confident about the prescribing drugs, and they do consider that increasing knowledge is they need to increase their knowledge. However, they do give for cold and flu symptoms, they do prescribe antimicrobials, and they do feel that overprescribing is better than the underprescribing, and they do prescribe many broad spectrum antibiotics as per their prescription. As far as conclusion is concerned, we all need to improve ourselves towards a better knowledge towards antimicrobials and antimicrobial resistance, because this is an emerging concern. Thank you so much.
Thank you very much, Dr. Saib. I have a few questions to you. Thank you again, because it is very important, and you highlight the point that it's a challenging situation for the antibiotic resistance and antimicrobial resistance. And 98% you mentioned that it is needed to have a more knowledgeable about the antibiotic use. So it's very significant contribution to the pharmacology. So with your survey that you have done is there any validated tool, or how did you validate that?
Can you please repeat the question? I didn't understand that.
Yeah, you have used the survey questionnaire for the, right? In the methodology, is it validated tool, instrument, and how did you validate that?
we basically validated it via conducting a pilot study on 50 of clinicians in Sheikh Hospital, and we basically enrolled microbiologists from the institute. We enrolled community medicine experts, epidemiologists, and medicine specialists, and there was a pulmonologist as well on the panel, who basically at the end of the day there was 7 panelists who decided that this is the final questionnaire, because we conducted a pilot study for that as well, and we finalized that this will be the questionnaire. And that questionnaire was also deducted from various studies as well. They have used the similar structure format, and we have referenced that as well in the whole article.
Thank you very much, Dr. Sohaib, for your presentation and all the questions, all the answers that you have answered. Thank you. So we will move on to the next speaker, Fitri Ramli from the Department of Pharmacology, Faculty of Medicine, University of Kamisah, Malaysia. The research topic is the mechanism of clozapine-induced cardiotoxicity on the cardiomyocytes, a systematic review. Okay, floor is yours.
Assalamualaikum and salam sejahtera. Today I'm going to present our poster entitled The Mechanism of Clozapine-Induced Cardiotoxicity on Cardiomyocyte, a Systematic Review. Clozapine is an antipsychotic effective for treatment-resistant schizophrenia. However, we must use clozapine with caution due to the risk of cardiotoxicity, including cardiomyopathy, myocarditis, and arrhythmia. This review aimed to determine the clozapine effects on isolated cardiomyocytes. In this review, the articles were retrieved from PubMed and AppScohost using keywords of clozapine and cardiomyocytes from inception to June 2021. Initially, we retrieved a total of 27 articles from 2 databases. Subsequently, following screening and selection processes, a final 5 articles were included in the qualitative analysis. We found that clozapine has a wide variety of effects on cardiomyocytes, including the reduction in glutathione levels, the increase in MDA and ROS productions and levels, the increase in lysosomal membrane disintegrity, the inhibitions of acetylcholine receptor operated potassium current, as well as delayed rectifier potassium current for the rapid components, the increase in mitochondrial membrane potential collapse, and the reductions in cell viability. To summarize, clozapine affects cardiomyocyte via oxidative stress, depletions of antioxidant, lysosomal and mitochondrial dysfunction, cell death, and arrhythmia. We would like to thank the Faculty of Medicine UKM for the support. Thank you.
Thank you. Dr. Shafira, have any questions?
Yes. Assalamualaikum, Dr. Fitri. How are you?
Salam, Doctor. Fine.
Okay. Interesting sharing. Thank you again. Is there any specific reason why you only choose 2 databases for this study?
Because of the limited resources in terms of times, and yeah. So actually we can expand more, but due to the limited resources.
All right. All right, Dr. Chichita, we can.
Thank you very much, Dr. Shafira and Dr. Fareez. Yeah, we will move on to the next presenter. Nurdarina Ausi binti zulkifli from University Science Malaysia. The research title is Neuroprotective Effect of the tulang honey on the kinic acid-induced neurodegeneration in the right lateral septal area, a preliminary finding. Okay, can start now.
neuroprotective effect of tonahani on cardiac acid-induced neurodegeneration in red letter receptor region. So briefly, cardiac acid aspirin model has been widely used to study the mechanism behind various types of neurodegenerative disease. And then upon binding cardiac acid on glutamic receptors, it will trigger serious cascade of events which eventually result in neural cell death. And tonahani is rich in phenolic compounds and has a potential protective effect on different brain regions. However, the effects of tonahani on cardiac acid-induced neurodegeneration in retroceptor brain region hasn't been studied. So based on in the study, the rats will be randomly divided into 4 groups, and each will be treated for 5 times at 12-hour intervals, 30 minutes after the last oral treatment. The rats were injected with cardiac acid and observed for seizure characteristics. The rats will be sacrificed at 24 hours or 5 days after cardiac acid administration. So based on the result, first this H&E staining shows control group with normal rounded to oval shaped neuronal cells indicated by the black arrow. Meanwhile, in cardiac acid group, features of degenerative neurons were observed, and pretreatment with tonahani or topiramate ameliorated cardiac acid-induced morphology changes when neurons appear comparable to control. And then the neurons were further quantified. Based on the crystal values analysis, the number of viable neurons in cardiac acid group were significantly reduced when compared to control at both time points. Moreover, the number of neurodegenerative cells in cardiac acid group based on FJC staining were significantly higher when compared to control. Meanwhile, in pretreated groups, the number of neurodegenerative cells was significantly reduced when compared to cardiac acid in 24-hour subgroup, and similar trend was observed in 5 days. So in conclusion, this result shows that cardiac acid-induced neurodegeneration in receptor region and tonahani might have potential in protecting receptor against cardiac acid-induced neurodegeneration. However, further study need to be done. And thank you. That's all from me. And this study was financially supported by University Science Malaysia. Thank you.
Thank you very much, Nadiana. Can I have a few questions? Yes, yes. You mentioned that your honey is very effective for that, or for the cardiac acid induced. So how did you determine the dosage?
The dose of tonahani.
Okay.
Okay, the dose of tonahani, this study is basically the continuous study from previous study, and previous study has shown that it can attenuate the effect of cardiac acid against oxidative stress and neuroinflammation, and so basically tonahani can reduce can attenuate the effect of cardiac acid in various brain regions such as cerebral cortex, brainstem, and cerebellum. But however, in later septum haven't been studied, so which is why we included in here.
Thank you very much, Diana. Yeah, very good presentation. Okay, we will proceed with the next presentation. AMIRA SYAHIRA from University Science Islam Malaysia. The title is Factors Predicting Emotional Distress Among the Frontiers During the COVID-19 Pandemic. The floor is yours.
Assalamualaikum and a very good day. I bid to everyone. It's an honor to have the opportunity to take part in this conference. My name is AMIRA SYAHIRA binti Muhammad AZMI from University Science Islam Malaysia. On behalf of my team, I would like to present about a study entitled Factors Predicting Emotional Distress Among Frontliners During COVID-19 Pandemic. The coronavirus disease 2019 that originated from China has been declared as a recent worldwide pandemic. COVID-19 exposure puts frontliners at a higher risk of physical and mental consequences as a result of providing care to patients with COVID-19. Therefore, the goal of this study was to investigate factors associated with depression, anxiety, and stress among frontliners during the COVID-19. This cross-sectional study involved the participation of 402 healthcare workers from the hospitals in Klang Valley. Thus, 21 questionnaire was used to assess the emotional distress among the respondents. The results showed that the prevalence of anxiety, depression, and stress among the frontliners were 36.3%, 28.6%, and 12.9% respectively. There was an association between marital status and all domains of emotional distress. Gender, age, medical history, and body mass index were all found to be significant predictors towards depression and anxiety. Further research are recommended to widely explore the outcome of this study and emphasize the emotional distress issues of frontliners during this COVID-19 pandemic. With that, I thank you.
Thank you very much, AMIRA. Very nice presentation. I'd like to call Dr. Shafira.
Yes, thank you.
For the questions.
Yes, AMIRA, thank you for your for sharing us your significant finding. Okay, from that finding, what is your suggestion? How it can help the frontliners?
Okay, thank you, Doctor, for the question. Actually, our study is basically focusing on the mental health, and after this, actually, we are planning to do intervention in order to support their psychosocial well-being of the shift workers. So our suggestion is we have to help the frontliners. Basically, we have to share with them how to overcome the stress and how to handle the situation. So our target is doing the module and also the intervention program to help them in this crisis.
Thank you very much,
thank you,
AMIRA and Dr. Shafira. Okay, we will move on. The next presenter, Sakiinah binti Hasan from the International Islamic University, Malaysia. The research title is Sperm Morphology and Testis Histological Changes in 12% High Cholesterol Diet Administered Rats Following the Tulang Honey Supplementation. Okay, ready? The floor. If it is ready, you can please start playing.
Assalamualaikum and greetings. My name is Sakiinah binti Hasan from IIUM. The title of my poster is Sperm Morphology and Testis Histological Changes in 12% High Cholesterol Diet Administered Rats Following Tulang Honey Supplementation and Diet Modifications. As an introduction, hypercholesterolemia is a recognized factor associated with male infertility. Tulang honey is a type of Malaysian polyfloral wild honey produced by the rock bee. It possesses anti-inflammatory and antioxidative effects, which may improve male reproductive functions. Hence, the study is aimed to determine the effects of tulang honey coupled with diet modification on sperm morphology and testis histology of 12% high cholesterol diet administered rats. So what did we do? 20 male sport dolly rats were divided into two groups. For control, they were fed with normal diet for 20 weeks, while for high cholesterol diet groups, they were fed with 12% high cholesterol diet for 16 weeks. Then, during treatment phase, they were divided into three groups. Group A was untreated, Group B was given 3 grams per kg of tulang honey, while Group C, the diet was changed to normal diet plus 3 grams per kg of tulang honey for 4 weeks. At the end of 20 weeks, all rats were sacrificed and the left testis and cauda epididymis were collected. We found that compared to control, Group A showed significant decrease in the percentage of normal sperm morphology. In contrast, both Group B and C demonstrated significant improvement in the percentage of normal sperm morphology compared to Group A. However, there are no significant changes in Johnson testicular histology scoring between the groups. As a conclusion, diet modification in addition to tulang honey supplementation may further improve male infertility in high cholesterol diet rats. Therefore, we need to further explore the potential of tulang honey in improving male infertility associated with hypercholesterolemia. Thank you.
Thank you, Sakiinah. I have one question. Yeah, very good presentation. How will you determine the duration and the dosage of the honey? Can you mute your mic, please?
I'm sorry. I'm
Yes.
sorry.
Sorry.
Thanks for the question. For the dosage of tualang honey, the doses will work out based from our local human intake for 60 kg of healthy adult. So the daily intake of 60 kg healthy adult is 1 teaspoon, which is 12 gram. So 12 gram divided by 60 kilogram, we get 0.2 gram per kg. And then we need to multiply with the red factor, which is 6. Then we get 1.2. So, and then we multiply it with 3 because we want to see if the higher the dosage, the higher the effect, the higher the improvement. And then for the duration, it's actually work out from the previous study. It's actually continuation from another study. And the pilot study showed that 4 weeks is the effective duration to see the changes in the sperm parameters.
Thank you, Sakiinah. Very good presentation.
Another question, a very general one.
Yes.
Dr. Sakiinah, why tualang, not others honey?
Okay, because from a review in, sorry?
Yeah, why you choose tualang, not others?
Honey. Okay, because from a review in 2011 and 2013, if I'm not mistaken, they found that among all Malaysian honey, they compared to the gold standard, which is Manuka honey, tualang honey possess the highest level of antioxidant activity and radical scavenging activity. Due to its high level of flavonoid and phenolic acid. That is the reason why we choose tualang honey.
All right, thank you, Dr.
Thank you very much.
Okay, thank you
All the
so
best.
much.
Yeah.
Okay, thank you.
Okay, so we move on. Next presenter. Dr. Yusof Kamisah from University Kamisah, Malaysia. The title is Pakia speciosa Has empty pot migrates the cardiomyocyte hypertrophy by decreasing the oxidative stress in the H9C2 cells. Okay, you may start.
I'm presenting Pakia speciosa has empty pot mitigates cardiomyocyte hypertrophy by decreasing oxidative stress in H9C2 cells. The pathogenesis of cardiomyocyte hypertrophy involves the occurrence of oxidative stress. Hence, it is believed a medicinal plant with antioxidant property would be beneficial in mitigating the cardiomyocyte hypertrophy development. Pakia speciosa or petai papan has been shown to possess antioxidant activity and protects the heart in hypertensive rats. Therefore, the study aimed to investigate the effects of the plant extract on angiotensin to induce cardiomyocyte hypertrophy in vitro. In this study, H9C2 cardiomyocytes were divided into 5 groups, namely control, Pakia speciosa extract alone, angiotensin 2, angiotensin 2 plus the extract, and angiotensin 2 plus valsartan. Valsartan was the positive control. After 24 hours of concurrent incubation, cell surface area, reactive oxygen species, and ADPH oxidase and superoxide disputase were determined. We found exposure to angiotensin 2 increased cell area, ROS level, and ADPH oxidase activity, while it reduced SOD activity. Concurrent treatment with the plant extract or valsartan prevented the detrimental effects of the angiotensin 2. The protective effects of the plant most possibly attributable to the presence of flavonoids, especially the quercetin. In conclusion, Pakia speciosa empty pot extract prevented cardiomyocyte hypertrophy induced by angiotensin 2, possibly by preventing the increase in ROS level and NOS activity, as well as the decrease in SOD level. Thank you.
Thank you very much. Dr. SYAHIRA, any comments or questions?
Thank you, Assistant Professor Dr. Kamisah. It's nice sharing on this petai. I have no question for you. It's very clear.
Okay, thank you.
Okay, thank you, Dr. Yusof. I have one question. It's very interesting. And what is the next step from here?
Oh, okay. So actually, we are currently there is ongoing project on this petai. So we are investigating on the MAPK pathway and isolation of the bioactive compounds from the petai.
Thank you very much. Thank you.
Thank you.
Okay, we will move on to the next presenter, Wei Chin from Monash University, Malaysia. The research title is Neuroprotective Potential of Lavandula augustifolia Essential Oil. Okay, we will start the presentation now.
Okay, so hi everyone, my name is Wei, and today I'll be presenting on the neuroprotective potential of lavender essential oil. So lavender essential oil has been used in the traditional treatments for cognitive-related disorders, and the prevalence of Alzheimer's disease is expected to increase as the population ages, and yet the current treatments remain symptomatic. So in this study, we aim to unravel the neuroprotective potential of lavender essential oil in an AD-like model, which we will induce by using scopolamine. So the cell line involved in this study is human neuroblastoma cell line, or SHSY5Y, and 4 different assays were carried out. So results show that lavender essential oil show a mild inhibitory activities against the cholinesterase, but they were unable to promote any neural outgrowth. And the pre-treatment with lavender essential oil improved the cell survival rates against the cytotoxicity of scopolamine. So to further study the effect of lavender essential oil, we have also looked into 2 major components, which is linalool and linalool acetate, that contribute 60 to 80% of the total composition. And as expected, both of these components were able to increase the cell viability, as well as to decrease the reactive oxygen species level in the model. So therefore, it's reasonable to assume that the neuroprotective effect exerted by lavender essential oil is attributed to the main components via the antioxidant mechanisms. So in conclusion, both lavender essential oil and the 2 major components were able to protect the cells against oxidative stress damages. And future work will focus on the characterization of the beneficial effect of lavender essential oil and the 2 main components, as well as to probe the antioxidant mechanism of the signaling pathway involved. So this is my presentation. Thank you very much.
Thank you very much for your presentation. Okay, Wei Chin. Dr. SYAHIRA, any questions for her?
No, great presentation. Well organized and look professional.
Hi, Doctor.
Hi.
Okay, thank you. So just one question. Are you from which source from your oil? Can you
we took the commercial essential oil, which is extracted by using supercritical carbon dioxide methods. Yes.
Okay.
Yeah.
Thank you very much. Thank you for the nice presentation. Okay, thanks. Okay, we'll move on to the next presentation by Dr. Krupavaram from the KPJ Healthcare University College. The research title is the evaluation of the antipyretic activity of the root extracts of the Durio-Cybertinus on Wister albino rats. Okay, we shall start the recording.
A very good morning to all the dignitaries of DICE. I am Dr. Krupavaram from KPJC. Today I am going to present on the topic evaluation of antipyretic activity of root extracts on the Durio-Cybertinus on Wister albino rats. And here is my objective where we are going to determine the antipyretic activity. Here are our secondary objectives by collecting the ethanol extract, finding a phytochemical screening method, all the phytoconstituents and antipyretic method. And these are the methodology. This is our grouping of animals where we are divided into 4 groups, only except normal control. All other groups we have given the yeast extract. After 18 hours, we have selected whichever is having the high temperature. And coming to the results part, if you see the standard drug has shown the very high activity on the 4th hour also. The low dose has stopped showing its action at the 2nd hour. 400 mg, that is the high dose, is started showing almost comparable with standard drug. It's continuously showing. These are the findings based on our research. And the discussion part coming here, because of the cyclooxygenase pathway could be the inhibited because all the inflammatory mediators. And the conditions may be reason why they are showing action, maybe the flavonoids, alkaloids, all these things available. And for this, definitely for the exact mechanism of action and what constituent is reason, all these things we need to further evaluate. And that's all for the findings, whatever we have done from the research. Thank you for the opportunity given. And once again, thank you so much.
So much, Dr. Shafira. Any questions?
Yes. Hi, Dr. Krupavaram. Nice presentation, nice sharing. Is there any reason why you start your treatment dosage with that 200 mg?
Can you unmute Dr. Krupa?
Yeah.
Thank
Yes,
you.
thank you, ma'am. So thank you, doctor. So the reason we select is generally we select from the OECD, that is the toxic dose, 2000. From there, usually we select 1/5, 1/10 dose of that. So 1/10 of the dose, it will become 200. So from there, we start calculating the drug activity. So we use 2 doses of low dose and high dose.
All
and
right.
yeah, high dose has shown the better activity compared to low one.
Yeah. Okay.
Thank you very much, Dr. Krupavaram, for a very nice presentation, and Dr. Shafira. We will have the last presentation of this section. Dr. Mahmood Rasool from the King Abdulaziz University. The research title is Identification of Recurrent Missense Mutation in SLC2810 gene in the Arterial Curiosity Syndrome patient in Saudi Arabia by the next generation sequencing. Can we play the?
Hi everyone, I am Dr. Mahmood Rasool from King Abdulaziz University, Saudi Arabia, Jeddah. We are presenting a poster on the identification of a recurrent missense mutation in the SLC2810 gene underlying the arterial curiosity syndrome in the Saudi Arabia by using the next generation sequencing. So arterial curiosity syndrome is an autosomal recessive and very rare genetic disorder. It is characterized by the tortuosity and elongation of the arteries, including both the medium and large size, along with the pulmonary arteries stenosis and the formation of aneurysm that lead to the death in the individual in the early years of life. So we collected the patient from the King Abdulaziz University Hospital and we done the genomic analysis using the whole exome sequencing. In that we found a genetic mutation in the SLC2810 gene in the homozygous state. Interestingly, this mutation was found as the heterozygous as well as homozygous state in the Italian patients. So we are analyzing further for this mutation using bioinformatics tools. Thank you so much everyone for watching this video.
Thank you very much for all the participants here and the judges. And we have the last speaker is not come for the live Q&A section. So we have the end of the section for the poster presentations, finalists too, with all the presentations. So before ending the section, I would like to thank all the presenters for your time, your effort, and all the best for your projects, and also our honorable judge, Dr. Shafira, for the time and participation here for the section. So before ending the section, I'd like to have your all videos on, and we will have a photo of this final presenters panelist section 2. Okay, any problem with the videos?
Dr. Chichita, are you the one who snapped it?
Vanessa will do that.
Yes, okay, I will take it. Okay,
Alright.
everyone smile.
Okay,
One,
thank you.
1, 2, 3. Okay.
Thank you very much, Vanessa, and all the participants and the panel. And then we will end today's section. And thank you very much.
Okay, thank you, everyone.
Okay, thank you.
Stay safe.
Thank you, Shafira. Bye-bye.
Thank you. Bye-bye.
We'll join to the next section. Okay, thanks.
Thank you. Bye.